They might be laying in bed. Oh my gosh, you all have your phones. We need this.
I wasn't on.
They might be laying in bed, they might be sitting in a chair. You can do an assessment wherever they are. Sometimes, depending on the setting, they're in a wheelchair because they're going somewhere. You don't want to throw them back into bed. You can do an abbreviated assessment and catch up with what you need to later. But when you get there in the morning, you're going to get report. As soon as you get report, you assume care of your patient. It is imperative that once you assume care of your patient, you get their baseline. So you go and you assess your patient to the best of your ability. If they're on their way out the door, you at least look at them, notice any tubes, make sure their heart's beating, they're awake. Hopefully you have enough time to get a set of vital signs before they leave, so you know where they were before they left. Okay? So, one of my pet peeves is when people come in and they say, "Hi Brittany, my name is Jody, I'm going to be your nurse today. Is it okay if I do an assessment on you now?" Sure. Okay, what is the problem with that?
They could say no.
What if they say no? It is your job as a nurse to establish their baseline when you come on and start your shift. So if you are asking permission, then if they say no, you're in a pickle and you can't do your job. Okay? So, this is better. Brittany, my name's Jody. I'm going to be your nurse. I'm going to take a quick listen to you. How did you sleep last night? Pretty good. Good? Any problems? Any pain this morning? No. No? Okay. Anything that has been bothering you or we need to talk about? No? Okay, I'm going to take a quick listen. And you guys can do this in whatever order. Okay? For your checkoff, I hope that you already have your vital signs done. Because if you don't, then you're going to have to do them during your checkoff and it's going to eat into your time. Because that will count. But if you go in and you get your vital signs, you write them down, then you just show me that's fine. That won't count in your time. Okay? So what I'm going to do is I'm just noticing her general appearance when I come in and I establish a relationship or talk to her at the beginning. So I know that she is appropriately dressed. Her hair seems to be combed. She actually has makeup on, so maybe that's from yesterday. She's in bed. And she has clothes and she looks comfortable. I'm going to start with my stethoscope first, and then I'm going to go to the head. If you want to start with the head, that's fine. There's no right or wrong. Who has a pen line? I don't have one. At this point, I'm going to talk to them about why they're here. Do you know what your, are you having any tests or anything done today? Yeah. No? Lab work. Do you know what the doctor has planned for you? I don't. Do you? No, I got a report that he's going to do a little bit of lab work, and then he's going to look at that and see if we're going to keep you today or let you go. Does that sound like what he's been telling you? Yes. Okay. I'm just going to check you out here, and then I will leave you alone. Have you had any problems seeing? No. You have any allergies? Yes. Allergies are really bad this time of year. Okay, I want you to kind of look at the ceiling over where the ceiling meets the wall over there. I'm going to shine this light in your eyes, okay? And I truly need this room a little bit darker to see. Okay? Now if you can look at my pen, I'm going to move it closer and just keep following it with your eyes. Okay? Alright, can you turn your head that way? Let me look. I'm looking at her skin, I'm looking at her ears, making sure I don't see any breakdown, making sure that her hair looks okay, it's not added, or she has any breakdown on the sides of her head. Okay, and this is extremely important if she has any oxygen on. Okay? And have you had any problems swallowing? Okay, and I'm noticing that her mucous membranes are moist. She doesn't have any fissures along her tongue, her teeth. look, very straight. I don't see any missing teeth. Can you open one time for me? Looks like she has very good oral hygiene. I don't see any, nasal congestion as far as runniness. It seems that she's breathing okay out of her nose. I don't see any nasal flaring or retractions. She looks very comfortable. She doesn't look like she's struggling in any way. Okay? At this point I can look at her jugular veins and I can sit her up a little bit to assess that further if I need to. And I don't see any JVD. And turn your head that way for me one more time. Okay. Alright, I've already assessed her skin turgor. I've already checked her radial pulse. I've already checked her capillary refill. So now I need to do a couple things. I need to listen to bowel sounds and respiratory, or her lung sounds. But I'm going to go ahead and move down and look at the rest of her extremities, and then I'm going to come back and do those two things. Okay? Alright, so if she has socks on, I have to take them off. Why? Okay, so I need to check her skin for any breakdown. I need to check her capillary refill. I need to check her pedal pulses. Okay? Okay, what is this pulse point called right here?
Dorsalis pedis.
Dorsalis pedis. I'm going to call that a 2 out of a 3. We can't fill this one. What is this one called? Posterior.
Tibial.
I can't fill this. Do you have any entries down here? Okay, so what do I do if I can't fill this? If I were to document that she doesn't have a posterior tibial pulse, what am I saying?
She's dead.
Well, it's just, yeah, it should poor circulation. And I don't know that that's true, because I can see that her feet are a little bit cold. She's got fingernail polish on, so I can't assess capillary feel really good. But she doesn't have any chronic changes. Can you move your feet back and forth? Wiggle your toes?
Would
What
you
do I
try
do?
the other foot, or you would just?
What do I do here? Get a Doppler. A Doppler is an instrument that magnifies sound, and you can put it here and then you can hear it. And so that's what I would have to do, if I can't find it. Okay? So now I'm going to take this sock off and compare this side to that side. Okay, again, here is her what?
Dorsalis pedis.
Okay, and that is a +2. Posterior tibial. I can't really find this one either. I'm surprised that I can't fill it. Okay, so I'm gonna have to get the Doppler again. Again, her feet are a little bit cold, but I'm assessing circulation, and it seems to me right now that she has adequate circulation. If she doesn't, if her feet were purple, if they were extremely cold, if they were very pallid or pale, and I didn't feel the dorsalis pedis, that would be in a medical emergency, and I would need to get the Doppler immediately and start calling some physicians, because that's a big problem. Okay? So now that I've assessed those things, I'm also at some point going to assess her skin. Now, if she really is a young lady who seems to be pretty healthy, I'm not going to strip her pants off her and look at her right now. She's probably moving around in the bed and doing okay. So when she gets up to go to the bathroom, or when I help her in a different situation, I'm probably going to assess her skin at that time. So I'm going to do the best I can right now. But I am going to assess for strength and range of motion. So I want you to push against my hands. And again, push against the hand. Okay? And can you move this foot like this for me? And wiggle your toes? Okay, very good. And now I'll put her socks back on. You always want to leave your patients how you find them, unless they say, oh, you know what, my feet are really hot, why don't you just leave those off? And then you would. You don't want to leave them uncomfortable. Now, do I need to have gloves on for this?
I was wondering that because sometimes your patients aren't going to be very,
Clean.
but you need to be able to feel like the warmth of their foot or the gloves kind of constrict your sensations.
You don't have to have gloves on, and actually it feels like you're alienating your patient sometimes if you have gloves on just for feeling it. However, if they have anything wet or moist, you need to have gloves on. So if they're sweating profusely, if they're vomiting, if they have something oozing out of their body, then you need to have gloves on. Otherwise, I had a student do this one time, came in the room, put gloves on, and did their whole assessment with gloves on, and it was very strange because it really felt like she didn't want to touch the patient, and so we don't want to alienate our patients by doing that. However, we don't want to catch anything or give them anything, so there are certain times when that is appropriate. Okay? Alright, so now I still need to do range of motion and strength on the upper body, correct? Okay, so grab my fingers and squeeze, please. Okay, and that's equal on both sides, and again, I'm checking for, to make sure that both sides are equal. Okay, and now range of motion, if she's moving around in bed, which I'm going to have her move from side to side here in a second, I don't really need any other range of motion at this time. Okay, so I'm going to listen to your belly real quick, and then I'm going to listen to your breast sounds, okay? Okay, now I'm going to listen to your breath sounds. If you could breathe in through your mouth and out through your mouth. Okay, now can you sit up, okay? I'll let you catch your breath for a second. Are you have any family that's been with you?
Yes.
Okay, thanks. Go ahead and breathe again. Okay, very good. Now while she's sitting up, if she really is in the hospital, she has a gown on, I'm looking at her back, I'm assessing her skin and her back there, without really exposing her too much, because it should tie in the back. I'm gonna have my stethoscope under there, and I'm just gonna look quickly to see if she has any noticeable bruises, bumps, masses, or skin breakdown. I'm also looking at the back of her head now. Okay, and neck. Okay, thank you very much. You can go ahead and lay back down. Okay, now I'm going to palpate her belly. I'm going to go back to that. Now you can palpate the belly right after you listen to bowel sounds. Again, you can create this in any way that you're going to hit everything. You don't have to do this in this order particularly. You just have to get everything done. So however it makes sense. And truthfully, you're going to check on the sickest part of the patient. For instance, if they are there for something going on with their heart, you're going to assess the heart first. If they're having respiratory distress, you're going right to the respiratory system. Okay? Alright, so I'm going to palpate her abdomen. Are you having any pain in your belly today? Is it hurt when I push? Okay. I don't feel any bumps down here like her bladder is distended. Everything is very soft. Her breath sounds were clear in all the fields. Her respirations were even and unlabored. Her apical pulse matched her radial pulse, and it was a little bit irregular. S1 and S2 were present. Her pedal pulses were +1 and needed Doppler. +2, it's 2 out of 3, and then needed Doppler for the which one?
Tibial.
Okay. Vocabulary refill was good, as well as her strength and range of motion on her upper and lower extremities. Her level of consciousness, from what I've gathered so far, what do I know about her? Level of consciousness. Is she alert?
Yes.
Yes. Is she
Responsive.
oriented?
Yes.
We haven't asked her.
We haven't asked her, but she's responding very appropriately to the situation. Does she know who she is and where she is? We don't know because we haven't asked. Now, when you come in, that can be part of your statement. At this point, you can say, go ahead and tell me your name and birthday. And you're probably going to have some paperwork, and just so you can say, let me make sure I have the right paperwork. Can you tell me your name and date of birth?
Brittany Stevens, 72580.
Okay, and do you know where you are?
Yes, that is one.
Okay, and do you know why you're here?
Yes.
Why are you here?
About nothing.
So now I know that she's alert and oriented to person, place, time, and the situation. Okay, time I didn't specifically ask her, but there's no reason, there's nothing that leads me to her being disoriented. So if you want to be absolutely sure, you can say, do you know the date, do you know the time, do you know the year? I will tell you, people in hospitals, they rarely know what day it is. And truthfully, if I didn't come to work Monday through Friday, I probably wouldn't know what day it is either. They're just there and they're sick. And they're like, I don't know what day it is, I've been here for 4 days. And that doesn't mean they have a neurological problem. It means that they lost track. They've been sick, they don't feel good, and they've been here for several days. Okay? What else? What did we miss? Anything? Do we feel like we have a good picture of our patient? Is there anything we didn't look at? I know something. I didn't ask her. What about bowel habits? When was the last time you had bowel movement? Yesterday? Was it normal size? And was it soft?
Yes.
Okay. Have you been urinating okay?
Yes.
Okay. And is it a pale yellow, bright yellow? Pale yellow? Okay. You don't have to ask those questions, especially if we're collecting it. You're just going to go look at their urine. Make sure they're not having any problems urinating. So now I've checked her circulation, I've checked her skin, and if I haven't looked at her legs again, I can either do that later when we get her up and get her ready for the day, or when we're helping her to the bathroom or something like that. Okay. We talked about bowels, we talked about urinary, we talked about breathing, heart, and we checked some neuro stuff. Anything else y'all can think of? Okay, so at the end of your assessments, you should be able to have a really good picture of what's going on. So then later when they say, I have this bump here and I didn't notice it earlier, and you say, yeah, I didn't notice that earlier either. But if they say, I have this bump here, and you say, well, I didn't look at it, I don't know, is that new? Okay, it makes you look bad as a nurse if you don't get a really good picture of your patient, so make sure that you're doing that. Okay? Alright, thank you, patient.